I got a gavel. You gave me a gavel this time. That's pretty good. So, welcome everybody. We're going to call the meeting to order. I guess the first thing we're going to do is do the pledge. Want to lead us, please? To the flag of the United States and to the republic which stands one nation under God, indivisible. Yes. Thank you. Everybody got a copy of the minutes in the mail from the last meeting. Are there any, well, let's do a motion. I need a motion to approve the minutes, please.
Move to approve.
Senator Lang, need a second? Okay.
Lou, second.
Lou, okay. Senator D'Alessandro, second. Any discussion? Okay, seeing none, all in favor of approving the minutes, say aye. Aye. Opposed? No, the ayes have it. Okay, the minutes are approved. Since the last meeting, we got three proposals in from three vendors to be our consultants to look at some of the key issues that we want addressed. And a subcommittee of Senator Lang, Charlie McIntyre, and myself met. Interestingly enough, we all read the proposals, and they were innovation, convergence, and then spectrum. And I did send a summary to everybody about the process that we did. But I started off as like being in a jury. I said, let's just have a first round of who would you pick as number one? And all three of us said spectrum. And then we went through a more detailed process of that. And it turns out spectrum was actually the low bid at 77,800 plus travel. Innovation was 80,000, and convergence was 123,000 and change. And then we used the process that Charlie has that he uses to assess these things, weighted 74% qualifications and then 25% the price. And it scored out that Spectrum was the firm. So we did, and then I sent an email to everybody. I said, it's, in lieu of having a meeting to get approval, I said, does anybody object? Please let me know. No one objected. So we started the ball rolling with Spectrum. But Charlie, can you give us an update as to where we are? Because, we need a contract or something, like important.
Yeah, so we're in the process now. It's with Spectrum, waiting for them to sign off on it. So, and after that, I think really they're just dealing the ministerial matters of the state, the Secretary of State sign off. And
so they've got a contract in our language?
Yes.
Yeah. Okay.
And so when we get that back, we'll submit it for GNC approval.
Right.
Yeah, because post haste.
Yeah, it has to be post haste because, time is clicking here.
Yeah.
And we need them for the two big issues that we're going to address. One is the allocation of the money appropriate between the state charities and the facilities, and the oversight, the regulation part. We want to compare us to these other states that have bigger casinos. So those are the two major things. There's some other little things in there too, but those are the main things. So it'd be helpful to get them going on this so we can then use their response, their observations to drive our discussions about that, and for us to come to some conclusions that we need to modify or whatever what we're doing. So hopefully, what's the drop dead for getting the executive council for March? Is it end? I think you said mid-March to submit, and then Kelly.
Yeah, there's a calendar. It's so many days ahead of the.
Right.
I'll have to check.
Okay.
Because when is the next meeting, the 27th? Okay. No, the 27th will be the following meeting.
Right.
It'll be the first one in April. Yeah.
So okay, let's think of it. So, but we're on it. We're trying to get it moving. What I'd like to try to do, and I'm going to talk to Charlie offline, is even though we may not have a contract, I think it may not be a bad idea, especially if they've signed off on the contract. I think it's 99%, I think it's only standard, 90%, 99% sure that the executive council is not going to say no. That I'd like to have them at least
If I
be
could-
able, next meeting.
They have said no before. Two commissions ago, they denied the contract for a consultant. So just preparing you.
I love this. But I'm sure they wouldn't mind zooming into our meeting so that we can start at least having discussions with them. I think, we didn't ask them to come in and I remember I was a consultant for 43 years. We just had to come in. We'd have to defend our proposals in front of whatever. We never had that part of it. So I don't think they would mind us zooming them in and having them fly in here to just talk to us about, I'm sure we all have questions about how this is all going to work. So if we can jump the gun and have that happen at our next meeting, that'd be great. So I'll talk to you more about that. Does anybody object to that, by the way? I mean, I think that's something we should do, just to keep the process going here. So, okay, last meeting, Dick, yeah.
Just a question on that, the scope of the services that are to be provided. You briefly alluded to them, but could you tick them off? What are we expecting from this group?
Well,
and specifically, I'm wondering about whether they're going to tell us anything about what other states are doing on problem gambling.
Yeah, and we and the other thing I thought, we're going to get copies of the Spectrum proposal to everybody, okay? I mean, it's in here, but the main things are what I just said. We want an outside person to come in and survey the industry with that knowledge to come in and tell us, that, especially on the historic racing machines, whether the allocation really between the facilities and the state. Because you can look at the state, the state's giving some of their money to the charity, it's like, or all three, really. But so, and then the other thing is oversight. How do we compare, given that we have all these big players coming in now, how do we look in terms of our oversight? Do we need more resource? Do we need more audits, for instance? Do we need more, things like that? And is there something that we're not doing that we should be doing to keep this tight? Now, I just spoke to the Assistant Attorney General before the meeting. He mentioned that, maybe it's a good idea to have maybe Maine or Massachusetts and we come in. We may do that from a regulation standpoint to talk about. And he said this morning, maybe Massachusetts is probably the better one to have come in. And hear from them. And we may do that. But again, to me, the real thing is to get the consultants going so that we have facts that we can work with them on back and forth as to what we want to do in those areas. So, yes.
Charlie, we're doing a separate proposal, aren't we, for problem gaming? Because if I remember right, the proposal we sent out for this one was regulatory and fee structure kind of laws. And I thought we were doing a separate one for problem gaming.
We would, yes.
Yeah, so there's a second one.
And also the scope also includes sort of the natural marketplace for New Hampshire as well, the Spectrum. That's the third component for this.
And we do have money, given that the proposal came in at about 80,000, 77.8, but then there's travel on top of that. And we have well, in that bucket, we have 125 for consultants, right? So there's, and I would imagine that the problem gaming one wouldn't be as expensive, but I don't know.
I wouldn't think so.
Yeah.
I wouldn't think so. If you want to do an RFP for responsible gambling consultant services, it would be
Right.
much less.
So then if we're going to do that, we should, it sounds like then we should start that process to find a consultant. Okay, so can we, do we have names of, maybe, matter of fact, our next agenda item is to have Ed Albert, who's really involved in problem gaming in our state.
In that regard, it's probably not unreasonable to sort of send an email or a request to the National Council on Problem Gambling, because they would have the most up-to-date national statistics, I think.
Okay. All right, so we'll get that moving. And we'll give everybody an update on that. Yep.
In that regard, they might even do it for sort of a donation, essentially.
Oh,
Like,
okay.
again, I also think this is the meat and potatoes, right? This is what the really heavy lift is, the laws and the regulations as they compare to other states. It's problem gaming is much easier lift when you're looking at statistical information and that kind of stuff. So I think, again, I know there are several places like Miami University of Ohio has a whole college division dedicated nothing but problem gaming and researching problem gaming. So
Yeah.
there are people out there that have a specialty just in that field. So.
Right, okay. Well, that's good. So, all right, I'm glad that came up, and we'll move that forward. Talking about problem gaming, last meeting, we had someone who was really under your tutelage, right, under your
Not my
staff?
tutelage, no.
No, your
So-
staff, your staff,
Yeah, well, was our head of marketing, yes.
right.
But
and-
I was also appointed to the council.
Right. And so we have somebody that's really in the trenches, let's say, really looking at this issue, and that's Ed Talbot. We finally tracked him down, and here he is in living color. So Ed, the floor is yours. He did give us a handout about his organization I put on everybody's desk here somewhere. Floor is yours. Can you push the button and bring the mic closer to you, please?
Thank you, Chairman.
The reason, by the way, I should say two things. We have our young lady at the end of the table here because she's hard of hearing. We're allowing her to sit there so no one, she's not on the commission. And these meetings are being recorded. They're being broadcast, just so you know. Okay, and then they're out there on YouTube. Okay, anyway, go through it.
Thank you. And thank you for the opportunity to present today. It's appropriate that I'm here today because March is Problem Gambling Awareness Month celebrated across the country, and we have many activities to go along with that. I provided a brochure from the New Hampshire Council, and the only thing I'd like to address in the brochure is the mission of the council. It's a 501c3 organization. It's a private nonprofit agency created to address the social, financial, and emotional costs of problem gambling. The council provides information, education, advocacy, prevention services, and referrals to treatment for those afflicted, their loved ones, and the general community. And the contact information, our website is all included on the brochure. I told the chairman that I had prepared something that I like to read because at 81 years old, I tend to sometimes get off track or say more than I should, and I want to be cognizant of your agenda. So if you'll bear with me, I'll be very glad to answer any questions you may have. My name is Ed Talbot, and I currently serve as the co-director of the New Hampshire Council on Problem Gambling, along with Angela Bergen of Bow. I'm an 81-year-old resident of Madison, retired from a 20-year corrections office as an administrator, and resigned as chief of staff when Massachusetts offered an extra 5 years of service. I took advantage of that opportunity. I went to work for AdCare Hospital, a premier substance abuse facility out of Worcester, Massachusetts. That involved getting people into detox and then transitioning from detox into outpatient services. My duties, I've owned a home in Madison, New Hampshire since 1990. It was primarily a vacation home for use of family, friends, and occasionally a rental. I sold that house in 2009 and bought a newer one closer to the water in the same development and declared it to be my retirement home and changed my residency to New Hampshire. On most Monday evenings, I introduce myself as Ed T, a compulsive gambler, with gratitude for 46 years since my last bet. My gambling addiction took just about everything for me other than the promise that there's a chance to recover and develop a better way of life. I was an incorporator, a board member, and a trainer for the Massachusetts Council on Compulsive Gambling. My work with Tom Cummings, the founder of the council, and Kathy Scanlon, its longtime executive director, provided a wonderful background for me in developing relationships to further identify, address, and treat problem gambling. I was in the first group of individuals certified by Massachusetts Council and the Mass Department of Public Health as problem gambling specialists. I contracted with agencies who primarily were providing substance abuse to deal with clients who also had a gambling issue. In 2013, I was spending more time in New Hampshire and planning to change my residency, but wanted to get involved in expanding gambling services in New Hampshire. And I made that known to Kathy Scanlon. I learned that the New Hampshire Council on Problem Gambling had been incorporated in 1996 by an individual also directing the Vermont Council on Problem Gambling. In 2010, the National Council recommended that each state be operated independently. We got a small group of volunteers together. The first roadblock we ran into was an annual report had not been filed with the Internal Revenue for 3 years, and under the Patriot Act, that eliminated the 501c3 status. After an 18-month battle with the assistance of Senators Shaheen, Ayotte, and Governor Hassan, it was restored to its 501c3. At my initial meeting with the New Hampshire Lottery Director, Charlie McIntyre, he stated that it was the social obligation of those providing legalized gambling to address problem gambling. Director McIntyre backed those words by arranging for donations totaling $75,000 over 3 years and in-kind services, including website development and hosting, brochure, stationery, and creation, printing, as well as use of office space for board meetings, and assigning his Director of Marketing, Maura McCann, to work with us. The 2017 legislation to authorize Keno included 1% of the proceeds be directed to problem gambling services and administered by the Department of Health and Human Services. We were the sole responder to a Department of Health and Human Services request for information for comprehensive services recommended for the state. But nothing ever materialized from that. New Hampshire Council has established a statewide helpline, an office at New Future's Ferry Street location. We were presenting at recovery centers and recovery coach academies, providing information for trainings for communities, state agencies, as well as charitable gaming providers. The council was successful in securing a grant from the New Hampshire Charitable Foundation to further expand our helpline. We also coordinated with 211 New Hampshire to respond to individuals seeking treatment for problem gambling. The 2019 legislation authorized sports gambling created the Council for Responsible Gambling, thanks to Representative Ames. It provides $250,000 annually to address problem gambling by way of contracts developed by and dispersed by the Responsible Gambling Council. We, the New Hampshire Council on Problem Gambling, were awarded the original contract at $100,000 a year for fiscal years 21, 22, and 23. On the day that contract was awarded, we had a bank balance of $172 and were 3 months in arrears with New Futures for our rent. And needless to say, the contract was welcome relief. We moved with New Futures to the present location, 100 North Main Street, across the street, signed a shared services agreement with them that provided an office, phone, internet, advocacy, and financial help, including bookkeeping, payroll, etc. Unfortunately, COVID hit and our personal appearances were hampered by the pandemic. Yet services continued, such as the helpline, via Zoom, FaceTime, and phone. Recovery support, especially in conjunction with Gamblers Anonymous, improved greatly. The Manchester meeting on Tuesday night became the first hybrid meeting in the area, where the meeting was held in person at New Hampshire, at Recovery New Hampshire on Wilson Street, in person as well as on Zoom. We have been proud to be part of that transition, and that meeting typically runs 10 to 12 people in-house, approximately 20 people online every week. An option to extend our contract for another year was initiated in April of 2023. We were asked to provide an outline of services that we would provide under that contract. That was done, but it was not accepted. The Responsible Gambling Council did inform us that they were hoping to secure an original amount for $250,000 in the fiscal year 24 budget, but wouldn't know if that would be successful. The New Hampshire Council on Problem Gaming made a decision to pass on that $100,000 renewal for three factors. One, a need to renew our contract with New Futures, including office space, equipment, and financial services. Having worked in the public sector in Massachusetts, I know what it was like to never have a budget ready at the start of the year. But in the private industry, I wasn't ready to sign a contract that would commit the council to a lot more money than we could actually afford. We worked with them to pare it down, cut back the services, and developed a budget that we felt we could handle with what we had and based on what we could foresee as income coming in, like contributions from DraftKings, $15,000 each year for a 3-year period, and our participation in charitable gaming, which now has been around $30,000. The council was informed by one of the commissioners that they were seeking $250,000 and would be hiring somebody with expertise in self-exclusion. And let me read from the email. Regarding our response to voluntary self-exclusion, this is tricky because we've discussed creating a full-time position, responsible gambling position at the lottery. If that position is created, that person would be doing a lot of the work required for us to set up a centralized voluntary self-exclusion process. But it is dependent on getting the New Hampshire Council on Responsible Gambling funded restored, and that's still an open question. So the bottom line is, if the council got to $250,000, they were going in a separate direction with this hired person and that. If the $100,000 were the budget figure, then it would fall back on us, which we felt we really couldn't handle something to that extent. So we made the decision to pass on that. That does not mean that we not participate in any opportunities to bid on what we think we can do. And the third reason, I applaud the industry for all the notice they take for responsible gambling. That's not our clientele. Our clientele are not going back to gambling. We don't teach people that you can gamble safely again. Most of the people we encounter have crossed the line. And I have to tell you from personal experience, in 46 years of attending thousands and thousands of Gamblers Anonymous meetings and talking to thousands of problem gamblers, I have never heard a person who relapsed come back in and say it wasn't as bad this time. It's a progressive disease. It's never going to get better. You can arrest it, but you're not going to cure it. So that was the basis for our decision not to seek funding this year. I'd like to talk a little bit about the helpline and then talk about what I see as the most critical need, and that is voluntary self-exclusion. I have figures on the helpline calls over the last 3 years, and the total number of calls that we received in 2021 was approximately 200. I'm not sure, some of the calls were December from the previous year and that, but it was around 200. Out of that, we identified 65 people as problem gamblers. In 2022, the calls went up to 227. 57 were identified as problem gamblers. In 2023, 306 calls were received. 78 were from problem gamblers. And so far this year, we've received 72 calls, and 13 of them were from regarding or designated as persons with a problem with gambling. We get many more calls. A lot of the calls, as you probably can imagine, are from loved ones of the gambler. And most gamblers don't pick up the phone and say, hey, I've got a problem. They're referred by somebody else. We follow up with the contacts. When we do get one, we follow up with them. We get calls from the media. We get a call from a representative regularly who wants to know why we can't be like GameSense in Massachusetts and have people station each one of the casinos. Well, if you got a $3.6 million budget like the Mass Council and compulsive gambling, you can afford to do that. But on $100,000, we can't commit to something like that. I think it's a great program and a great idea, but we can't do that. We also get calls from groups to do presentations on that. So there are a lot of other calls that come in. Not the 6 calls actually represent a figure of what we feel is accurate information for the number of problem gamblers who reach our helpline. I just want to add one more figure to that. I said there are about 35 people who normally attend the Gamblers Anonymous meeting on Tuesday night in Manchester. 1/4 of those have come through the New Hampshire Council helpline. There are two people that are in that meeting now, one who has celebrated 2 years in recovery, another one approaching 1 year later this month. With the help of Maura McCann and the New Hampshire Lottery, self-excluded through the ILOT and that stuff, and they're doing very, very well. So it's great to have that option, and it calls out the need for that. I received, regarding voluntary self-exclusion, I'm so glad the commission is interested in addressing that, because I certainly believe a centralized system is essential in the state. 2 weeks ago, I got a call from Mrs. Locken from G2 Gaming, who had called the New Hampshire Lottery, and they referred her to me. And I guess they oversee, their company oversees Ocean Gaming. And they wanted to know if the people who had self-excluded at their casino were registered in our database. Well, A, we don't have a database. Positively, the state should have one. And I told her, and she was astonished. She said, most states do. And I said, I understand. We're trying to get something like that developed. Hopefully in the future, and we'll be very happy to work with one. One of the things that I don't understand, and I'm sure you'll all agree with this, you take a person who admits to having a gambling problem and tell him he has to go to each and every one of these places to self-exclude. You're putting him in the gambling situation itself. And you hope that that's satisfactory. And they're not provided with any treatment information. There's only 3 Gamblers Anonymous meetings in New Hampshire presently, one in Dover on Monday night, one in the Manchester meeting on Tuesday night, and a third one in Hampstead on Thursday night. Those are the resources we have. We have some councils for training. Now, since we've gone, I don't want to say independent, but since we passed on the state funding, some of the things that we have done is the website had been developed by Title Media under the New Hampshire Lottery. We've gone independent. We've created our own website. We can make changes on the fly. My co-director was an expert in computers and all that stuff. I'm not. She makes the changes. She handles all the social media things. So we have our own website now that has prompted a lot of donations as well. We have, PayPal on there so people can donate. Finally, we have created what's probably the first I know in the region is an intensive outpatient program developed with one of our board members, Sister Mary Joseph, works for Rivermen Behavioral Health, which will provide intensive outpatient services to people with a gambling problem. We've never had such a group. They're off for substance abuse, and that's very, very effective. So a person early in recovery would go to a group like that. We also have developed a pilot course for clinicians, peer specialists, and which we will be offering in May. We're going to do that free of charge for the first pilot program, and then after that, we'll be charging. We're working with New Hampshire Alcohol and Drug Councils Association to provide that training. And finally, next week, Tuesday, is National Screening Day for Problem Gambling. We will be doing a public screening with all clients who attend Riverbend's Choices Behavioral Health Program next week. They'll all be screened for the presence of gambling, and we provide that information to Harvard University, the Division of Addiction, where they coordinate all that. And finally, we'll be addressing on the same day on Tuesday a group of guidance counselors from schools in New Hampshire regarding problem gambling, especially with adolescents today. I thank you very much for your attention, and I welcome any questions you may have.
Let me start. So you get 100,000 from the state, correct?
Well, 3 years.
For 3 years.
That ended.
Okay, and that ended. And the rest is you fundraise, sounds like.
The rest we have in what we had left in the bank balance wasn't an awful lot. We're projecting $30,000 in revenue from Charitable Gaming. We're projecting $15,000 in revenue from DraftKings as the third year of their installment to every council in the United States gets $15,000 a year for a 3-year period from DraftKings.
So
That was when they got the NFL contract.
So last meeting, we had an interesting discussion about breakage. And per the statute, when the historic racing machines came in, breakage was to go to this fund, this problem gambling fund. We found out that one of the vendors isn't contributing because they don't have that in their software. But let's just say the other two are contributing. So this money's going somewhere. Is it that the legislature has not appropriated you any money? Because, can you please?
So when you identify a revenue source, you also have to identify the budget amount.
Right.
And so the budget amount is $250,000 for this fiscal year, and the source is breakage. Last year, it was 100,000, and source was breakage. It exceeded last year's amount. It's not quite as much this year as the 250,000, but it doesn't matter. We still will contribute the amount that you folks dictated in the budget. So it's one of the.
So then why, then who spends this money?
So right now, there's been no expenditure this year that I'm aware of from that funds. The amount, the $200,000 is just, I don't think it's been spent.
All right, well, so it's just sitting there.
Yeah.
It's because the legislature in the budget process hasn't appropriated any money to,
Nope, the money's been appropriated and it's in the budget. It's just there's been no expenditure, which is, as Ed suggested, I think 3 years ago when it was Health and Human Services or 4, I think there was 800,000 in the account that was not expended. At the end of the year, if it's not expended, it literally just rolls into our transfer amount for the transfer, the education trust fund.
right,
Because well, let me back it up a second. By the terms of the Constitution, the lottery's revenues are revenues minus expenses equals transfer to education trust fund. And the way this is set up, the responsible gambling is an expense of the lottery. And if there's no expenditure, then it's literally rolls as a transfer.
right. So, yeah, Senator, yeah.
So my question is, it sounds like you don't have a contract with the lottery, so is it just a matter of we need a contract executed in order to expend those funds, and we've let the contract lapse, and you already have the statutory authority? to
Correct.
expend funds?
So the contract is only administered by us. It's not, by design, as you can imagine, I'm not in charge of responsible gambling in the state. That would be very much a conflict with my job. And so there's a separate council that's supposed to manage that function.
And so at this point, so again, I'm just trying to get pragmatically where we're stuck at.
Yeah.
Where the problem is, right, where the breakage is, no pun intended.
The breakage is broken.
And so, right now, we have statutory authority to allow to pay them to continue to service problem gambling in the state. We just don't have an executed contract from them through whether it's VHHS or the Commission on Problem Gaming, who would authorize the contract.
Correct.
And there's money in the account to do that.
Yeah. Well, it's not the money in the account. It's literally just a budget. It's a line item for us. But yes.
So Ed, I think you have your marching orders. You know, we need to work on getting the contract to the commission so they can help fund some of our problem gaming.
Well, is there anybody, there's one more question over here, I know, but is there anybody else? It sounds like you are the group that is doing something on this front in this state with a lot of volunteers.
Yeah.
Is there anybody else that you know of that's doing what you folks are doing?
I do not know of anybody else in the state that's doing it. I mean, other states have councils and they do work and all that. We have 2 part-time people. Dr. Bergen also works for Riverbend and Concord Hospital. I work part-time. We each devote our talents and our services. I do most of the administrative, recovery support, and the helpline work.
Right.
I handle the helpline almost exclusively. I was just in Aruba for a week, and Dr. Bergen took it for the week in Aruba cost me COVID. I had dodged COVID for 3 years, and I came back and got that. But Dr. Bergen handled that. We also have somebody in the recovery program. If I need somebody to take my place on the helpline, they'll handle that call.
Right.
But other than that, all the helpline calls go
Okay,
through.
thank you. Well, you have a question over here and then.
Yeah, I want to thank Mr. Talbot here for his testimony. It was very good. If it'd be possible here to have your prepared remarks given over to our secretary and sent out to all the members here emailed.
Yep, we'll make that happen. Yes, can you get us a copy? Thank you. Representative.
I'm just wondering whether this has to be looked at through the RFP process.
That was my next question as well. That's why I was asking, are there others out there? I would imagine it has to be, but Charlie, I'm looking at you.
It does. Yeah, I mean, it has to be, anytime it's a state contract, it has to be a bid process. So
Yeah, another question?
I know there are several national organizations that handle it for a lot of states. And they're usually the ones who respond to the RFPs as
Okay.
well. So
All right, thanks. Senator, yeah.
Thank you. First of all, thank you very much for your testimony. Appreciate it very much. The 15,000 that was allocated because of the NFL, because of,
15,000
yes,
DraftKings.
yes. Now, how was that? Who receives it and how is it received?
Each council in the United States, state council in the United States gets that, gets $15,000 from DraftKings.
So there's no state involvement in that at all?
Not
That's
at all.
a
It
direct,
goes, it
that's
goes
a direct
directly into your
appropriation.
account, deposit in your account. You give them the account information. Actually, it was the last 2 years we got it in January. We haven't got it yet, so I don't know whether DraftKings is a little tight right now. I can't imagine that, but that's due. But they give each council in the United States $15,000.
And is that just for 3 years?
The contract was for 3 years, and this is the third year of the contract. They haven't said anything about going any further. They send out a survey every year. What have you done with the money? What suggestions do you have in that? We've responded to that all the time.
Okay.
That's like I heard at the last meeting that 211 New Hampshire was somehow going to take over the helpline. And that we're with 211 New Hampshire since 2015, that they have all our contact information. Somebody calls with a problem gambling and that, they refer to us. If I could just make one suggestion regarding the 250,000, I really think that kind of money would be well spent if you could develop a voluntary self-exclusion that would cover the entire state. We're not those people. We're not going to create a database and maintain a database and that. It's going to be somebody else. And that's what I said, and I sent a separate note to Charlie, that we're doing the things that we know we can do physically and financially, and especially use the volunteers. We're not Mass Council. We don't have a budget of $3.6 million. In addition, they got the Office of Problem Gambling Services that has spent $7.8 million on prevention and $1.9 million on treatment in the last 10 years. And I think that, what was that called? Public Health Trust Fund or something that they all had to pay into?
Yeah,
It's like,
it was from years of casino.
yeah. I mean,
So-
huge sums of money.
So when you use the words state recognized, who recognized you? You know what I mean? You said you were state recognized by DraftKings. I mean, but what makes you the state recognized? To me, that means something.
We had the existing council on problem gambling. It's because we had a council and we're functioning as a council. We
Okay,
got that money.
right. All right, well, Representative Ames goes first and then.
I first want to say thank you for being here. And I think back to my first meeting you when I was working on the Gaming Commission at that time in 2013 or 12 or somewhere around then. And you were doing the good work that you're doing now then. And have obviously carried on with it. So many thanks for
You
that.
impressed me so much then because I couldn't believe a representative was down in Massachusetts attending as many functions regarding problem gambling. I said, talk about doing your homework. So thank you very much.
Thank you. I think a big part of there's a big problem here that's structural that we need to address. Right now we have I believe it's titled Council for Responsible Gaming. Do I have that right?
Yeah, you just pulled it up.
How about that?
Council for Responsible Gaming. It's RSA chapter 338-B.
Right. So that's a statutory, state-established council. And the members are, I believe, are appointed by the governor and council. Is that what it is?
Correct.
And that's where the money that's the result of breakage or whatever else that comes out of the state's treasury is going, and then for allocation out. There are structural problems. One, Charlie alluded to, that its independence is compromised, and Charlie's put in a difficult position, having it essentially in his office. And we need to think about how that might be restructured. I've talked on previous occasions with Charlie about positioning it over at Health and Human Services, and maybe that would make sense, but we never really got to the point of being confident enough to push that. So we need to think that through, and I think we'll be helped. It's very helpful to have the input from Mr. Talbot that we've gotten today, but also I'd love to hear from Massachusetts, which is sort of at the other end of the spectrum, and they've had, as part of their big gambling bill, when they jumped into big-time gambling, they had a comprehensive commission and allocated a stream of money that's going into responsible gambling automatically as gambling proceeds. So there's a lot to learn, I think, from their experience that goes into both research as well as treatment and prevention. And so we've got our work to do, and I hope we'll be able to both get a good handle on what the world that we're living in has to offer here in New Hampshire, and then what we might be able to do.
In the last meeting,
make it better.
I think we talked about this council, but it sounded like it's not a very active council. Right? Do I have that correct? Senator D'Alessandro, did you have your hand up before? Yeah.
Just to finish up, I think Representative Ames is correct. There's a council, but it's a non-entity in essence, really, because you don't have any money. That's number one. And number two, you haven't got any people. How the hell do you do it without any money, without any people? And we gotta, we've talked about it, but we haven't delivered. And I think two things ought to be made clear to the public. In most states, you have to be 21 to go into a casino. In New Hampshire, you have to be 18. Huge differential right there. And that's something that we ought to look at, because my involvement in this game has been for a long period of time. And what supposedly is happening across the country is younger people are becoming involved, particularly as sports betting has been opened up. And the phone, the sports betting, and the fact that we're 18, because I believe in our surrounding states, it's 21. Am I correct?
Very correct. I don't know whether you saw it, but there was recently a story in the Boston Globe where the director of the Massachusetts Council on Compulsive Gambling noticed that her son had $50 withdrawals coming out regularly out of the bank. 18 years old, he was involved with 3 other guys, and they were betting sports in New Hampshire. And this is the son of the person directing the Mass Council. So.
Thank you, Mr. Chair.
Okay. So it sounds like we have some work to do here on this one. I would suggest the next step.
To that point, fundamentally, it's an operational issue, not really we all agree that we should fix this issue. The problem is we've allocated enough money to look at the problem, but not fix the problem. And technology is great in the sense of, in both of the bills we drafted, one for the internet, one for sports betting, we mandated a voluntary self-exclusion as well as limits, that you can set your own limits. And also the technology behind DraftKings and our lottery platform is if you call our call center and you use words that are troubling, we actually disable your account. So those type of programs are great. The problem is it's where people are physically in locations. We can't do stuff like that. So we have to do the fundamental things of at each location have folks available to talk to people if they have a problem, because I think Mr. Talbot would agree with me that it's when an individual identifies themselves as a problem, that's the time to approach them. It's not a call from a family member because the person's probably not ready yet. And so it's going to stand up sort of an agency on its own, either reporting Health and Human Services or I'd rather not say this, but if it has to be us, it has to be us. And have some operational people stand up a program that's in every location as part of a mandatory self-exclusion program that the operators have to absorb and permit.
Now, I was going to digress a little bit. I'm going to look at the two folks from the industry. So I know in the historic racing bill, we had something to do with problem gambling, but it was having a plan to identify problem gamblers, if I recall.
Yeah,
So, and,
I can answer that if you want.
Sure.
Yeah, there is a plan. It is submitted to us, and then our agency reviews it, audits it, and confirms that it's occurring, and every building has cleared that audit process.
okay, so but I'm going to look at the facilities and ask, it's nice to have a plan, but have you referred any problem gamblers, I guess is what I'm getting at, identified and referred?
I don't have the exact counts off the top of my head, but I know we have a proactive problem gaming plan. We have a voluntary self-exclusions 2, 5, or lifetime. But again, it's only our properties because there's no linked database.
Right, there's no, right.
And we put every employee through problem gaming training when they start to make sure they can recognize and proactively approach. And
Like your dealers and so forth can identify?
everyone
Everybody,
from food and
right,
beverage to
okay.
across the board.
How about at your facility? Is it similar?
Our facility is very similar. We have a very similar plan, and I think our biggest hurdle is just catching them at the door because we can't scan those IDs. And so you have to recognize them, catch their name as they come in. So I'd say that's our biggest hurdle. But we do track them. Once they use the rewards card,
All right,
we can go over and say you've self-excluded,
right. Okay, well, look, I'll have to watch. Okay, we got to move forward now. Very great. Thank you. You've really spawned a lot of thought here. That's, we're going to be talking to you more over time. Oh, yes, yes.
Mr. Talbot, thank you again for your testimony. I'm Mark Delafano, I'm an Assistant Attorney General, Department of Justice. Maybe you know, or perhaps some of the industry folks on the commission may know, do the substance abuse treatment facilities or services here in New Hampshire or maybe in other states in New England offer programs around problem gaming? And if so, does anyone know whether or not that's covered by medical insurance?
Very true. Most substance abuse facilities, most problem gamblers, or 76% of problem gamblers also have a substance use disorder. It's comorbidity is a big problem. They're very similar in their treatment. However, there are slight differences. For example, you wouldn't smoke another joint or drink another beer and figure that's going to solve all your problems. The gambler thinks the next bet he makes is going to take care of everything, everybody will love him, and of course that doesn't happen, so you spiral down. Or if he does win, that just reinforces the fact to keep gambling. So the treatment is a little bit different. Any substance abuse clinician could see a client. Billing is what is difficult. Some will cover it. It's recognized under DSM-5 now as a disease. The healthcare model is in place, but it's usually tracked under behavioral health. I know when I was providing service in Massachusetts, there was a special behavioral health code that would signal the money was coming because of a gambling disorder. But a lot of private insurances aren't covering it yet.
I do have one more question. You had mentioned problem gamblers is anonymous. I don't know if that's the exact title. So is it your organization that runs those meetings, or are there other anonymous groups out there?
All those organizations are run independently. Each group is independent.
Okay, but there are others around the state?
Yes.
Okay,
Smart Recovery is another one, but the three Gamblers Anonymous meetings are Dover, Hampstead, and Manchester.
okay, all right, thank you. Thank you very much for your time. And commission members, we've got to think about what we want to do next with this issue, but we're going to move forward on the agenda here. So we have 3 more guests now come in. Can someone we got to pull one more chair up here. So if we're gonna talk about one more thing on the agenda. Hang on, one more thing. For Charlie first, sorry. Charlie's already designed and sent out a charitable gaming survey. We're going to get the survey form emailed to us sometime, hopefully today. It's pretty extensive. I just seen it for my first time, and Charlie, why don't you just update us on it?
Yeah, so as I described earlier, that we were going to do a survey of the charitable gambling area, and we're working with UNH. That went out 8 days ago, 10 days ago. And it could be the link will be over this week. Of the 800 charities, I think so far we have, at least as of last Wednesday, we had 260 responses. So I would anticipate more than 300 responses total, which obviously N equals 300 is a valid survey sample size. The questions include both, percentage click boxes, like there's 4 choices, choose one, as well as open-ended questions where they can respond with a word or two. So it was, like I said, it was drafted with the help of UNH, Andy Smith, and I'll forward you the survey when I get back to my office. I didn't have time this morning to print 20 copies, so I didn't.
And his team is going to reduce the data for us too.
Yeah, well, exactly, yeah. And then his team will come here, present the results.
Okay, sounds good. Any questions on that?
I thought that was a little faster than going out to bid in a contract because we have a research budget, and obviously charitable gambling is part of our operation, so.
Okay, Tom, thank you.
Well, I was one of the individuals who received the survey. Easy to go through, well presented, and I think a great list of questions and the stuff, so that it was pleasant to fill out, basically, here to get through.
Yeah, it was an email from me, and I probably got 150 responses. So I had a busy email day.
So it's good to hear it wasn't overtaxing. So, okay, well, thanks, Charlie, for the update on that, and thanks for your comments. So, we've invited 3 different charities from different regions of the state and of different size facilities. We have 1 to 3 of you come up. We have Don Morrissey from Lakes Region Casino, which is he representing leadership Lakes Region. We have Mike Balajurin from whose days are at Lucky Moose, and he represents the Lions Club. And then Larry Cameron from Angel Flight, and he's at the Brook. So can all 3 of you come up and pull one more chair up? Thank you. What happened to our friend?
Don left the room for just a minute.
Yeah, he'll be back. So why don't we start with the 2 of you? What they're going to do is each going to give a brief description of their charities and just general comments about their relationship with their facilities, and then we'll open up the questions. So we'll start here.
My name is Mike Balajian.
You can move the microphone closer to yourself. You might just slide it over. You can slide it over. Yep.
My name is Mike Balajian, and I'd like to represent 2 different charities tonight because we're in Lucky Moose with both of them. First one is the Exit Area Lions Club, which covers 6 towns on the seacoast, same as our school system. And we've been at the Lucky Moose now for a couple of years, and the process has been extremely easy. And without the money that we raise from them, we could not do the programs that we do. We've been able to, in our area, add on to what we do. This last couple of years, we've added on fuel assistance for those in need. We've been going to the schools and finding out single moms, and we're able to help 22 different charities, 22 different families the last 2 years on heating, and I think that made a big difference. We support food charities, it goes on and on, eyeglasses, different surgeries, and fundraising is getting harder all the time out here. And this has just made life so much easier. And in the Lucky Moose alone, there's over 17 Lions organizations. And I know there's some down at the Brook also. And talking to them, it's made an incredible difference in the communities that we take care of. The other group that I represent is the New Hampshire Police, Fire, and EMS Foundation. We're a 501c3 that was organized about, I think, 06.
Um, That is an organization that helps first responders in time of need, not mostly work-related. Sometimes if they run out of workers' comp is one thing, but we help with, like, right now, we're doing helping a family, a firefighter out of Milford. He has a set of 3-year-old twins. One of them just came down with a very acute case of leukemia and is undergoing 32 treatments down in Boston. And he's unable to work it is without pay. We have taken up that project, and for the next several months, we'll be paying a minimum of $1,500 to help keep that family afloat. It's that type of thing that we do. A lot of cancer problems, and the longer the foundation's been around, the bigger the need. We do other fundraisers, but at this time, I like to say that everybody out there is chasing the same dollar with businesses, and there's only so much they can do. The paper process the state has put together has helped us tremendously. And before this last couple of years, I think my wife has been fingerprinted more times than anybody in the state with the two organizations. It's streamlined, it's easy. The people at the Lucky Moose are very easy to deal with. And basically, at this point, I don't know what we would do without the help that the state helped us with. I think it was a wonderful idea to partnership with the charities on the state's portion.
Thank you for this. What we're going to do is let all three speak first, and then we're going to ask questions so they can all answer the same question.
Okay.
We got,
All right, Larry Camerlin.
Larry, right.
I guess we'll go next, right, Patrick? Right in order. Hi, Larry Camerlin. I'm a Catholic priest, and I'm the founder of Angel Flight, both New Hampshire and New England. And Mr. McIntyre, we loved your survey. We filled it out, returned it the same day we got it. So we should be one of the first ones that you received it. It's an absolute honor and a privilege to be here with you today. And I'm so glad you invited us all to speak of charitable gaming and the profound effects that we're able to provide for the grant staters here. I established Angel Flight New England in 1996. We're a nonprofit 501c3 organization, and we provide unlimited free flights to medically stable ambulatory people needing to access medical care. We were doing a fundraiser at Bretton Woods, where we bought a condo back in 1994. And in 1995, we were doing a ski event, a fundraiser there, and a lot of the local people who live there full time, want to participate in it and support it. And as we were doing that, as they were going around, trying to get auction items from the local businesses in Littleton and Berlin and Gorham and everything, we suddenly realized the profound need in the North Country, for access to medical care. And we knew there was one there, but a lot of our volunteers said, we need to start a full-time program, marketing Angel Flight, doing community outreach throughout the entire state. And we found people, especially in the North Country, felt much more comfortable if it was Angel Flight of New Hampshire. So we incorporated Angel Flight of New Hampshire back in 2006. And in 2012, we started a relationship with Seacoast Funding, which was the original poker room, as many of you probably remember. And through 2012 through 2019, we received $150,875 from them. And then when they transitioned to the Brook, from 2021 through 2024, we received over $329,000. So in total, we received, as of 2 weeks ago, $480,631.53. And the Brook has been an absolutely incredible, generous, tremendous partner to us. They are such wonderful people. I've known Laurie since she was at the poker room, and they are thrilled that the partnership that you allows people to access health care. Now, we have over 450 volunteer pilots. So whatever pilot flies the flight, he or she picks up the entire cost out of their own pocket. We also have 2 major airline partners, JetBlue and Cape Air, and they give us unlimited positive space seats on their flights for our patients when either weather
or distance precludes us flying in little airplanes. Now, our planes like 4 to 8 seat planes, you know, and we've flown out of, and we still do, of course, fly out 13 New Hampshire airports. Manchester, of course, Pease, Concord, Nashua, Mount Washington Valley, and Whitefield, Lebanon, Keene, Laconia, Berlin, Claremont, Skyhaven, and Hampton. And we have flown, what's remarkable when we were doing these statistics to present to you today, that the people coming from 105 New Hampshire communities. And our very, very first, I'd like to tell you a few stories about our patients. And our very first two patients was Lieutenant Commander Dave Hill. He was in the U.S. Coast Guard. He was based at Pease. And his wife took the 1.5-year-old son down to Delaware to visit her parents. And while they were in Delaware, the baby had a massive seizure and was admitted to the ICU. Well, she took their only car. So he had called an 800 number and heard about us. And we flew him on May 31st, our very, very first patient, you know, from Pease down to Delaware. The second patient was a New Hampshire resident. He was 8-year-old Patrick Kerouac out of Manchester. And Patrick had diagnosed with a glioblastoma brain tumor. And he was operated at the Elliott Hospital. And he did very well initially. And then it came back about 1.5 years later, and they referred him to Dana-Farber and the Brigham. He went there for treatment, and then they said, well, there's nothing more we can do, you know. But there's a new protocol, a new clinical trial at NIH in Bethesda, Maryland. Well, at this time, his mother Sharon called us. Patrick was only 8, and they had exhausted the family funds, you know, between co-pays and deductibles and mom and dad being out of work. And this is what happens with patients we see that we fly. So we flew Patrick 8 times in a clinical trial to Bethesda, Maryland. You know, unfortunately, that clinical trial did not prove efficacious, and Patrick did pass a few months later. But we have been able to fly, as I said, you know, people from 106 communities, thousands and thousands of grant staters, you know, to 93 medical centers throughout the United States. And in my handout, I gave you on the fact sheet, you know, just a sample of some of those medical centers from Memorial Sloan Kettering, Children's Research Hospital in Colorado, Duke University, Cleveland Clinic, the Mayo Clinic, Kennedy, Krieger Institute in Baltimore, Maryland, plus all the Boston hospitals. And we featured little Adam on the front cover. Adam, a small child from Brookline, and he suffers from OI, osteogenesis imperfecta. And it's a very, very rare disease that's incurable. And we fly him to the Krieger Center in Baltimore. Currently, I included this picture one of our pilots took of Morgan. She's 33 years old, and she lives in Londonderry, and she has a brain tumor, and we're flying her daily to Brigham and Women's Hospital in Boston. But she has to be there at a very, very certain time, exact time, for her treatment. And so with weather issues this winter and freezing levels, and even though the lack of snow, we've had an issue with snow, it's easier for her if we buy her an Uber. So we'll purchase an Uber ticket and put her from Londonderry, I think it's to Manchester, and then we put her on Concord bus lines down to Boston. So whether someone needs a flight or they need an Uber lift to get to a larger airport, or if for some reason they can't fly because of medical reasons, you know, recent surgery or cardiac surgery, that's what we'll do. We're also flying a young man, Lenny, out of Portsmouth to Dana-Farber. He has a very rare disease. We started flying him on December 23rd. And also Linda, we're flying out of Pease to Mount Sinai Hospital in Manhattan. And since 2022, we provide her with 100 flights. there's a great story that I forgot all about. And during my research, I remembered it. And back on December 9th, and it's in your booklet, 2010, there was a patient, his name was Ken, from St. Louis, Missouri, and Kathy from Pelham. Now, Rebecca of St. Louis intended to give her kidney to her fiance, Ken, at Barnes Jewish Hospital in St. Louis. At the same time, while Kathy from Henniker had planned on donating her kidney to her sister-in-law, Kathy from Pelham, at Dartmouth Medical Hitchcock Center. But neither were a match. And now they started this experimental national donor matching program through NIH. And when they put them in the database, they found that the people in St. Louis were the match for the New Hampshire patient, and the New Hampshire patient was a match for the person in St. Louis. But now how are we going to do this? So this was the first intra-region paired kidney transplant in the history of the country. So Dartmouth Hitchcock called us, and we had two of our pilots, one in the St. Louis area and one from New Hampshire, work with the hospitals. We made sure we had a good weather window, again, because these are small planes, and they decided to meet in Pittsburgh. So both donors, the kidneys were extracted, put in coolers, one brought to Lebanon Airport and the other brought to St. Louis, put them right in the planes, met on a taxiway in Pittsburgh, brought the kidneys back, and successful transplants. Isn't that awesome? I mean, that was incredible. It was the first one ever, in the United States. So when you look at, in fact, we have 80 pilots who are New Hampshire residents, and we fly people from over 100 communities out of 13 airports to 93 medical centers throughout the United States. The support we get from the Brook and your wisdom through charitable gaming and the partnership with New Hampshire nonprofits and the commission and the casinos has been life-saving for so many people. I mean, it's a third of our budget a year that this provides us with service. It's awesome. I can't thank you enough.
Thank you, Father. We're going to have questions in a minute, so the only other thing I want to say about the Seaport, was that the old shoe store that we were usually in?
The Brook was the old shoe store.
Yeah.
Yeah,
The
it was
Seacoast, right. Yeah, I remember, as I live on the Seacoast, I remember driving by there once, before I knew anything about it. I was in a legislator, I knew anything about charitable gaming, I'm going, geez, the old shoe stores now have poker. I didn't know what the hell that was.
I know.
I know there was poker, I guess they had poker.
What was the name
So-
of the shoe store? Do you remember?
It was a Dexter store.
Yeah.
Right, okay, very good, thank you.
Sure.
And last up is Don Morrissey.
Yes, good morning all, and thank you for this opportunity. I don't have a kidney story like Father Larry, but
Thank God.
thank God. We are so very pleased. I represent two nonprofits in the Lakes region, Leadership Lakes region, which I was a co-founder of in 1996. It's a regional leadership program for up-and-coming leaders in our Lakes region community. We are one of several in the state of New Hampshire. I believe we have the distinction of being the only independent program, non-affiliated with a corporate sponsor or a chamber of commerce. In addition to that, I also am the treasurer for the STEM Education for Youth nonprofit, using aviation and aerospace as a basis and a focus, and we're based at the Laconia Airport. That's called Win Aero. So Leadership Lakes region was my first, and in 2009, I was asked to join and help form Win Aero STEM Education for Youth. This has been a wonderful benefit, the gaming program, charity gaming, a wonderful program for us because it enables us to do additional things that our budget simply cannot do. We're all volunteers. We have no paid employees. We do have an independent contractor whom we compensate. But other than that, we're all volunteers on our board. This enables us, the proceeds, and I should preface this by saying, last fall, we received our initial benefit for Win Arrow from the Lakes Region Casino. And this spring, we received our initial benefit from the Lakes Region Casino for Leadership Lakes Region. So I'm new to the game, but based on what we've had this past several months, it's been a fantastic benefit for us. It will enable us, for the youth in the STEM education program, to offer scholarships to disadvantaged youth and to students of color and to students of underrepresentation in the aviation and aerospace industry, primarily females. And these scholarships will help them realize a summer camp environment on focusing on what they love to do, aviation and aerospace. For Leadership Lakes Region, it will help us defray our expenses. We have an annual class of 25 leaders. We meet 8 times a year, and we provide the lunches. We provide catering for graduation, recognition plaques when they graduate, and rent for facilities when we need it to house our particular program days. And there are themed program days throughout the year. Education, economy, the history and culture of the Lakes region, Lakes and Environmental Day, Political Issues Day. So these are themed events for us throughout the year, and the funds that we've received will help us defray our expenses. It's an expensive program to operate, and this will help us immensely. A word, if I might, about, I will just say what my colleagues at this table have said. Our representation was through Lakes Region Casino in Belmont. The general manager there could not have been more supportive, more helpful, and more genuine than you could expect. He was terrific. I went and met him for the first time. He walked me through the entire process. He told me what I had to do. He gave me forms that I needed to fill out for the state. And just overall, he was a tremendous help. And I was very taken aback how sincere and cooperative he was, since he was going to be giving us money. But it was a pleasure to work with Ryan Glotty, and I would like to commend him in front of you. So thank you very much.
I just want to start with the first question, and then Representative next. So let's start with you, Larry, because you're the newcomer to this. So how did you find out about charitable gaming, and how difficult was it to get dates? Because there are charities. Well, the way it works now, each of the facilities manages their own charities that come to them. And there's no real centralized way for, oh, we're all filled up, go up to the lakes, they have dates. That's something we need to work on this commission. But I'm interested in knowing, because you're new to the game, like you said, how did you first find out, and how easy was it to get dates?
I first found out about this opportunity when an Air Force, I'm retired Air Force, and a retiree that I know in the area who's on our board for Win Arrow mentioned that at the Seacoast, a nonprofit he was associated with was part of this charitable gambling initiative. And I said, what is that all about? And he explained it to me. I picked up the phone and called the Lakes Region Casino, and Mr. Glotty said, come in and see me, how's 2 o'clock sound? And
there you go.
And that was it. Now I did, however, try for the leadership program. Someone said, go to the bigger casinos, there's more opportunity there. And more opportunity sounded like more money to me. So I did approach the Brook. The lady was very cordial and pleasant, but she had no vacancies. And I approached Gate City Casino, again, very nice, but they had no vacancies. So I went back to the well, to Lakes Region Casino in Belmont. Fortunately, he had a vacancy. So both of our organizations are tied to the Lakes Region Casino.
And are you getting 10 days at each?
I am, sir, yes.
Okay, thank you. Representative, you had a question? James?
To a large extent, your question took care of that, but I would say, my questions really have to do with the expectations, but both the access to the days that are assigned to you, and you've spoken to that. If there's any different experience, I'd like to hear it. And then there's talk about best days and not so good days. In other words, some days when people gamble a lot and can be expected to, and some days that are sort of a day to stay home, shall we say. If there's any information on that, I'd be interested in that. I think we would be interested in it. And any other expectations that the casinos have of you, that you'll promote the activities at the Brook or whatever, or do events that might help publicize the opportunity to engage in gambling at these casinos, anything like that. I'd really be interested in
Is that a
getting.
question for everybody?
Yes, that's a question for everybody.
Okay.
Hi, Representative Ames. I was very reluctant at first about going to a casino. I had never been in a casino. I don't gamble. We had a convention one time out in Las Vegas that I went to, and I was very, very uncomfortable walking through the casino to get to my room. That's not my scene, I've always kind of equated it to, the mafia, gambling crooks and stuff like that. So it made me uncomfortable. But what was amazing, as you just said, the experience at the Brook and going back to the poker room with Laurie and the management there, they have the most wonderful, kindest, committed people. And when we filled out our application and met with them, it wasn't what can Angel Flight do for them, it's what can they do for Angel Flight and the citizens of New Hampshire. And I've gone up there a couple of times, so when we pick up the check once a year or stop by to say hello, and they give us a tour of the casino and their function rooms and stuff like that. And they said, if there's anything ever we can do for you, like if you wanted to hold a fundraising dinner or something like that, we'd love to help you out. But never any quid pro quo, never any suggestion, well, you better do an event here or else. Nothing. I'm blown away by the goodness, the genuine goodness of the people and the leadership of the Brook,
Let me ask you a follow-up on that. So do you get, are you 10 days all at once, or do they break it up 5 days and 5 days, or 3 days and 7 days, or?
It's always been, I think since the days of the poker room,
Yeah,
it's 10 days all at once.
okay.
Yeah, I think maybe for their accounting, and you get that daunting paperwork they send you, probably because of the Attorney General's requirements, so it's been 10 days.
Okay, Senator Lang.
Thank you. So I think a piece of the question I think Representative Ames had was, I remember Charitable Gaming when it was Monte Carlo night, right? And they would set up the tables and you'd play at a local golf course or something like that, and the charity would collect its funds and they'd tear it all back down. But it was a similar obligation that the charity would help promote the Monte Carlo night. Do you guys do any active promotions for saying, hey, this is our window of time at a gaming operation, please come support us? Do your charities do any of that active promotion to help them?
Oh, we don't.
Okay.
Probably because I didn't think I should, I didn't even think of it. Now, that's a great idea.
Not that it's required at the Lucky Moose, but when we know we have our 10 days, we flood it all over our Facebook, all of us, all of our members. There's 14 different directors. We flood it on that. It's on our social media and ask everybody to promote it. It helps all of us. It's not required, but it's something we make sure we do on a timely basis. And I know one of the groups that we do, there's groups that actually go down and help participate, just to help everything. So,
Well, we've left a lot of money on the table, I think, huh? I'm gonna do that. Thanks for that idea.
Yeah, Tom.
At the Lakes Region Casino, I echo their comments. We were never asked, I was never asked to promote anything about the Lakes Region Casino. I did promote it to our alumni in the leadership program. We've got about 460 alumni now in the 25 years. And I sent out an email saying, hey, here are some dates. I explained what the charitable gaming rules were and how this was a benefit for us. I don't know if any of them took advantage or not, but that was the only promotion we did, and it was initiated by us, not by the casino.
Okay. Any questions? Oh, go to.
I think we've already, yeah, what I'm gonna ask, again, we've gone over it before, but basically we have 3 charities here that without the charitable gaming, am I correct in saying that most organizations, the go-getters, if you want, in the organization, if you have a fundraiser, they're there, they're devoting their time to that fundraiser, again, to really increase the funds, but it's the same individuals who basically turn around and provide the service or try to get the basic program. So that you're basically burning them out if you've got to go over and really put their activity into the fundraising aspect, where charitable gaming kind of relaxes that a little bit.
it sounds like you know that first.
Yeah.
That's a problem all clubs are having. It's the 80-20 rule. 20% of the people do most of the work. They'll come for the fundraiser. And it's just been a very difficult time on the outside fundraising these days. And I've been doing this since 1991 for several different charities. This has definitely made a difference to keep us active with the communities.
And I would echo those remarks too. You can't go to the well too many times. And if we're doing something in Vermont or something like that, if someone's going to put on a third-party small golf event for us, you can't ask the same people to go out and get auction items for you. For everything you do, you burn them out and people get tired, and you can't keep hitting up everyone on your donor database. Oh, would you attend this? Would you attend that? Would you go to this? Would you go to that? Pretty soon they'll just take us off their mailing list, or, especially emails and everything. So that's a challenge, like you said, we face too. So,
Good, still good morning. Good morning. Thank you for coming here this morning. Do you folks have excess funds, or do you spend your budget every year from charitable gambling?
We spend pretty, I have to watch it real close as we get to the end of the fiscal year. We're lucky if we carry a few $1,000s.
So if you were to get additional funds, if the ratio of profitability for charitable gambling were to increase, would you be able to assist more New Hampshire citizens?
absolutely, positively.
Yes.
Yes.
And so there's unserved need that's not met by your organizations
Yes.
because of funding.
Yes. And let me just can I give you an example of that? Could I speak to that? Let's just say in the North Country. We all know when you get above the notch, weather changes and wealth changes.
Of course.
And a lot of times, if we're trying to fly someone out of Berlin or Claremont or something like that, say down to a Boston or New York hospital, because they've been referred because of a new clinical trial. And for us, equity and access in healthcare is paramount. And it's a different weather system up there, as we all know. So we might try to plan a flight, out of Whitefield, or Berlin, but the weather precludes us from doing it. And so many times we'll give a person a gas card. We'll send them a gas card, say for $100 for gas. Can you drive from there, down to Concord or to Manchester to a bigger airport or Laconia where the weather is more conducive, where we're not going to have freezing levels at 1,000 feet, or icing issues and stuff like that. And the other big problem we have, which we're working on right now, is community outreach. I mean, if I had a $2 million budget just for New Hampshire for community outreach, I'd go through it. It's the hardest thing in the world for us to keep the word out there that we exist. You've probably never even heard of us, you know? And so the need to do outreach into the communities, and not only to the hospitals, but town halls, police, fire, social media, newspapers. I mean, it's a daunting task, you know, to do that. So I wish we had triple the money we're getting from the gaming. You know, it'd be what we're getting now is a godsend, and we're extremely, extremely blessed and grateful to have it. Because if we were to fly you once or 1,000 times, it would never, ever, ever, ever cost you a penny. And we would never accept a donation from you if we were flying you. Some people, not many, you know, would send a donation to us, thank you for flying us, and we send it right back to them. We just void the check and we send it back to them. Because this is our time to take care of you. Because people, when they call us, they're running out of money, they're running out of hope, and they're running out of time. And because of the copays and the deductibles and the out-of-pocket pharmaceutical expenses, now here's a new clinical trial or protocol that could save their life. But they just can't get to it, you know, and that's where we come in.
Representative said.
Thank you, and thank you all for your testimony. This commission is tasked with a list of things that we should look at and weigh. And I'm kind of curious, as much as the perspective of the percentage that a gaming room brings in, more of that percentage going to charities. Also, unlike what Don experienced with Lakes Region, a lot of these operators have a lengthy list of charities that are in the queue looking for those dates, and that's something that we get calls about often enough. I guess what I would weigh to you, especially with the substantial component, Father, of your charity that's very well known, if we are tasked with whether to, and I'm just theorizing here, you know, out loud, with a lottery system, say drawing, you know, blanks for dates for charities, and you've been a part of charitable gaming on the Seacoast for a long time.
Yes.
And a benefit, and the charity and the end users, you know, listening to the testimony, it's phenomenal. But I guess, how would you look at it as charities, as to how we would deal with, as a commission, the problem of equitable distribution? Would it be something we should look at? And you also said you'd love to have 3 times as much money. I'm sure every charity would love to have that. But we kind of have a quandary in that there are a lengthy list of charities that are looking to get entry into this availability. I'm involved with some in Salem, many of them. And I guess, what's your perspective? How should we view this? Should we be looking at maybe from 10 days to 3 days or 6 days per charity to distribute that revenue in a different fashion? I guess, what would your input be? Should we look at a lottery system? Should we look at, you know, the national profile of a charity or the state profile of a charity? We're going to have that issue at this table, and it's something that maybe some of and you're representing, you know, a number of different charities, but your input may weigh in here, and it's a real problem. That there's going to have to be some equitable distribution of these funds to charities. And I know everybody's protective of their own charities, but how would you suggest we best tackle that subject?
Well, if I could answer, maybe one of the first things. Now, I have not had time to think of this. Right, so this is just off the top of my head. I guess I will look at the length of time a charity has been involved with charitable gaming in the state. The funds they've been receiving and how those funds impact the delivery of services by the charity. and the depth of impact that charity is making for Granite Staters. And are we talking about giving X amount of dollars to, say, Friends of the Library, in Twin? What impact, what need do they have, and what impact is that going to have in people's lives? So being in healthcare all my life and healthcare ministry, we're talking about people's lives as far as we're concerned. And 40% of the people we fly are children. And of course, the rest are adults. And none of these are frivolous flights. Probably 80% are for people suffering from cancers and different types of cancers or rare diseases. And if because of the relationship we have with the Brook and this commission and the philosophy of the state, we can save hundreds and thousands of people's lives a year and over time and bring them a level of hope that was unimaginable before they knew about us. To me, that's the test on the value of charitable giving.
Oh,
Just to follow up, and I understand, appreciate, and agree with you, but here's the problem, here's the quandary. What I'm looking from you is something's going to change. I'm not saying that's going to, but in this scenario, something's going to change. Less dates, the possibility of having no dates. How do we choose charities in a structured format? And you've already answered some of that. What's our best avenue to approach this? Because I'm not sure, and we can probably get it from the operators, as to how many charities are in the queue. And I can tell you this, that you're in Nashua, but your charities aren't based in Nashua. All over. Okay. I'm aware of many charities that partake in towns that they're not based in, because there's not a charitable gaming room in every town. Some towns or some rooms will favor the charities because they're in that town. I'm looking for you to give us a little input, usable input, as to where's the guardrails and where should we stay as legislators in placing those guardrails, because it's brought up many, many times to us that it's not necessarily fair, and you also testified to, and I have it in the rooms that are in Salem that have been there since inception, charities that have been the legacy charities since the beginning of charitable gaming. Some would argue, well, they've had their share. Well, is that necessarily fair too? We need some real answers, some real honest discussions from the charities, and like I said, everyone's going to defend their own. But what's the best way? Give us a little input on that from that perspective.
Let me just, because I had a similar kind of a thing. So when we did the historic racing, we doubled the number of charities that are involved. Now there's 2 dates. It used to be 1 date, now there's 2 dates. So we were able to double. Does your room have historic racing yet? Historic racing?
Yes, they do.
They do? Bellin has historic. So all three have historic racing. So here's the issue. Some of these places are growing and growing. Brook, big, right? So I'm sure you're reaching 100,000, no problem, in your 10 days. And as these places grow, and some of the other ones that are smaller are adding and growing as well. So is there going to be a ceiling of the dollar amount? Because the dilemma of us doing something drastic is that a lot of these charities are dependent on this money now. To try to wean them off this money, it's very, very hard. So we have to be aware of that too. So, but the way I'm thinking is we may have to put a cap on as some of these places grow and grow. If they're going to double their business in 3 years, does that mean that the charities, do we go to 3 charities? Based on, I'm big on trying to protect. Even when we did the 2 dates, we took care of trying the legacy charities to try to make sure they didn't lose too much when during that transition period. So, I mean, if we were to say to you, out of this commission, we're gonna put a ceiling on it, but not hurt you where you are. I mean, so that other charities could participate. Would that be a reasonable thing to do?
I think it would be.
I do too, because that way, we could, and there's no greed, you could tell by that. No, I mean, that way you can plan on, for your budget purposes, usually how much you'd get in that year.
Right.
So in order to help additional New Hampshire charities, that would seem very reasonable.
Given the number of locations we have in Hopper that could potentially open, there's gonna be opportunity and some of these are gonna grow bigger and bigger. And that basically, the way to handle this is basically growing more revenue. Then we can cap those, to a reasonable amount. And then use the rest to maybe create more dates, for other charities.
Yeah, we had one of our volunteers, one of our Earth Angels, our ground crew drivers, who lives in the Nashua area, came to me and says, geez, I forget what it was in Nashua or some other casino I never heard of. I told them all about Angel Flight, and they would like to offer you a week for charitable gambling. But when they knew we were getting the money from the Brook, they couldn't do it because they said you could only have a 10-day period a year.
Yeah. Okay, any other, real quick, okay, sure.
Good morning, gentlemen. Thank you so much for your testimony. Mark Delafano, Assistant Attorney General at the Department of Justice. As you can imagine, our department is interested in things like accounting and accountability. And so I have a question for each of you. It's a kind of a two-part question. First part is, how do you treat the monies that come in from charitable gaming on your books? Do they come in as just a general donation, or do you track them as charitable gaming revenue in some way? And second part, are you able to track the dollars that come in from charitable gaming and see it applied to your various programs as opposed to things like marketing and administration?
Well, maybe a little difficult to answer, but when we have different fundraisers in our Lions Club, for example, and we have a very set budget, income and expenses. Our treasurer and secretary do a great job reporting it back to the state. So it does go on our books as charitable gaming, auction, whatever it may be. And then we have a budget that basically just, we vote on what we're gonna spend through the course of the year. And if part of gaming, where we did make a lot more, we took like $15,000 of what we made and gave it right to fuel assistance. So at the end of the year, we can tell you every dime that we spent on every charity that it came in. I can't say that we mark, okay, all the gaming money we pay for this, because it does kind of go into a general fund with other budgets, with other fundraisers.
As far as the Angel perspective too, it's pretty much the same thing. We have a very sophisticated system of accountability, and we're a 4-star charity and charity navigator. And as donations come in, our accountant, our external CPA, and our internal bookkeeper has a chart of accounts. And is it a general donation? Is it a bequeath? Is there income from our annual appeal? Is it money from an event? That's how we categorize the monies. And then 100% of our monies go to program services. So we need to recruit pilots. So a lot of them is pilot recruitment and training and, maintaining their resources to make sure that they're current. They meet the FAA standards, they meet our standards, that they're safe to fly, people and their families. So I think pilot resource management is very, very key for us, community outreach into the area, and also flight mission coordination, because we have several full-time people that 24 hours a day answer the phone and coordinate all these flights. And we have found ourselves this past year, more recently, spending thousands of dollars that we did not anticipate on buying people airline tickets. you know, when JetBlue doesn't fly that route, or the weather is too bad for our pilots. And pilot availability is a crucial thing for us. You know, 10 years ago, we had 1,200 volunteer pilots, and now we're down to 450. A lot of people have gotten out of flying, especially around COVID, when they, you know, they lost their jobs and they had to cut back on their expenses, or they have 2 kids or 3 kids in college now. Since they first started flying for us, they were all in grammar school, they didn't have these college expenses. So it's just like the lady from Londonderry. You know, we're giving her money, we pay for an Uber, and then we pay for a bus trip.
Yeah, but I think the question really was about the process that you go through.
Yeah, so we have a very sophisticated process. It's very detailed and, you know, highly accountable.
Right. Yeah, follow up, well, after,
We're not very sophisticated. I enter it in the bank account. We have 2 accounts. I enter it into the bank account as a donation. For example, payment number 1, Lakes Region Casino Charity Gaming. And I enter the dollar amount in the account. But then I share with our board, obviously, how we're doing and what that was. And we immediately look at scholarships for either people coming into the leadership program or for the students whose families simply can't afford the summer camp, the STEM summer camp. So we, in our heads, earmark that funding for scholarships.
Follow up. So, you know, just based on the operations that you folks work with or oversee, what are your thoughts on if the state required some kind of report from each of your charities that listed on it where all of the charitable gaming revenue went? Is that something that would be, I guess, offensive to your charities? Would it be something that would be difficult to produce or create too much administrative burden?
Well, it would, I labor over that annual report. And thankfully, my wife has an accounting background and we have a calculator, so we bang it out together. But yeah, it would be burdensome, but I understand accountability. And if the state required that, we obviously would comply. But it would be, we're all volunteers. None of us gets a paycheck from the organization. So, but it would be a little bit of a burden, but time consuming.
As far as Angel Flight goes, we're used to that. We have to give detailed reports to JetBlue on all the vouchers used, the patients' names, the ticket numbers, the traveling. We have a large partnership with Alexian Pharmaceutical on rare disease patients, that they give us funding for lodging, transportation, stuff like that. So we have to give them extremely detailed reports, and also the Maine Cancer Foundation. So we have to detail where we spend every penny. So it would be another report, but if you would be happy to do it.
I guess I'll echo the other two. It's something that I don't think we would like to see happen, but if it did, we could definitely cope with it. With other fundraisers coming in, we just have to be more careful how we separate it and what we earmark, what we spend. It's something we could definitely do.
okay, any other questions? Seeing none, well, thank you, 3 of you, very much.
Thank you, everybody.
It's
Appreciate
been
it.
very helpful.
Thank you so very much. And
Yep.
if we can ever be of help to you guys, like, you know, Representative Sett, on answering some of those questions, you know, if you sent us something, we'd do our best to respond to you in writing, you know. Thank you.
Thank you very much. So we're going to do a little speed dating here. The next 3 items, just to keep the discussion going on the breakage discussion. I'm still not comfortable that one of the vendors is not contributing to the fund. So I still think we need to come up with a solution to that. I know some said, well, the money's, but the charities are getting the money or whatever, but I think if we have a process, everybody should be abiding by the same process. You know, and maybe we just say we get rid of the breakage part and then just other states charge the equipment people a fee to do business in the state. we really don't do that, right? A little bit, a little teeny bit?
No, manufacturers don't pay a fee whatsoever. And certainly, I've talked to the manufacturer, one specifically, and they'd be happy to pay a fee versus change their programming. And I think fundamentally, I think it makes more sense to do away with breakage and charge the manufacturer's annual fee. But that's a legislative fix.
Senator?
Look, the quandary is gonna be this, I think, Charlie. A, you're gonna have more and more machines. So the breakage numbers are gonna increase quite dramatically. The more machines you have, the larger the breakage. So it seems to me that the fee makes sense, because everybody would be paying the same. It's how are you gonna establish the fee, I think is the key item. The only thing you have to go on is what's happened prior to, in terms of the breakage for those who represent it now, vis-a-vis those that don't. But breakage is a very significant player in this game, particularly as you add more and more of the historic horse racing machines.
Right.
I
So,
mean, I think
Senator Lang?
that's an axiom, isn't it?
Okay. Senator Lang?
Again, so, yeah, I think this is an either or kind of conversation. We either do away with breakage as a whole and either charge them either a flat fee or a percentage of DGR, a percentage of handle. And that would, if we did a percentage of DGR, a percentage of handle, that would adapt based on the size the industry grows. And the number, as we have more machines and more things, I'm not sure we're really talking about machines because breakage is generally out of, yeah. So, but again, as that industry grows and we know that money goes to problem gaming, that money would grow to go to problem gaming. And I'm just not sure if the answer is percentage of handle or percentage of GGR, but that's the way I would approach it, to make it and just do away with the, return breakage. Let the operators do what they want to do with the breakage, either roll it back into the pool or whatever they do. But they would have a fixed they would know that I have to pay, quarter of a point on my gross handle to go to problem gaming.
But again, it would be interesting to find out what other states do with this. I mean, there's plenty of gambling going on in a lot of other states, but that they do charge. I know it sounded like they do charge for the vendors to hardware the in our case, historic racing vendors to pay a fee, a substantial fee actually.
Yeah, I mean, certainly it varies by whether it's a upfront fee to do business, it's a per machine rate, if it's as Senator Lang suggested, a percentage of TGR. Certainly the breakage right now isn't going to the operator in these contexts. It's going back to the player base in terms of the pool, so.
Okay. All right, I think we're getting a little closer here. And I think we're, okay. But what I mean by that is that the way it is now should be changed. Okay, now how it's gonna change, we have to fill in the gaps in the next couple of meetings.
Yeah.
So, all right. We heard about opt-in, opt-out. Now, right now in the pipeline, and senators and chair over here, where are we with limiting the number of facilities? Where does that all stand? I don't know, are there competing bills or where are we?
So we have, what was the bill number you sent back over, 112?
Yeah, I think that's
So
right.
112,
Last
back
SB
over to
112.
the Senate. We haven't acted on it yet from the House with the change. The Senate did pass, I forgot the bill number, I'm drawing a blank on it. But that creates a 7-year moratorium, allows for the incremental growth for the applicants that already have applications in play. And that's passed the Senate. I believe that's over in the House now, or should be going to the House.
Well, after crossover, do you think?
Well, we've been sending them early because I already have 2 House bills for Senate Ways and Means. So I know we're sending the bills over early. So I don't know where that bill stands in the House. That bill had the 7-year and we added in the municipality piece on that bill.
Right.
So municipalities get a certain number of days similar to a charity, but only if there's no charity available for the days. That's how we ended up coming to an agreement. And I think it was.
I just can't remember if there's a competing bill.
Well, the competing bill is 112 that I'm holding, which is a permanent moratorium. And I'm not sure,
It sounds like a.
Fred, you might remember, does that have the incremental growth in it as well, 112?
You'll have to explain, I haven't read the this other piece, so increment, what do you mean incremental
Well,
growth?
the people, I can't remember whether 112 had everybody's already applied up to October.
Yes, it has.
It is in there as
Yeah.
well. So the only difference in between the 112 and the bill that we sent over is the municipal piece of 7-year moratorium as compared to a permanent moratorium.
Okay.
Yeah, if I'm
The
correct,
moratorium,
it's pretty,
Year moratorium, is that up to, does that bring us up to about 19 licenses?
Well, both bills would.
About to
Both
19?
bills, yeah, both bills would allow for I think Charlie, you said there was 5 pending applications or
I
something.
don't dare change my answer, so, yeah. Yeah.
So the rumor.
Well, there's 5 applications in the process.
So we don't know whether they're going to
So
be
I,
approved or not.
yeah, yeah,
Up
that's,
to,
yeah.
would bring us up to 20 total.
and we're talking about opt-in, opt-out, and it wouldn't affect any of these
That's what I'm getting
applications,
at.
so
That's what I'm
what does it
getting at.
matter?
I mean,
If going forward,
if there's going to be a 7-year moratorium at that number.
yeah, we're talking specifically about
And their
HHR, not about future gaming
Right, and
operations.
Then they're grandfathered into the old statutes that do not have this requirement of asking a community to opt in or out. Is that correct?
Mhm.
Right. So then it becomes kind of moot in the, it's just the way charitable game has grown up. Never had an opt-in and out clause for communities. And it was always handled to some degree through ordinances in terms of, okay, you can have it, but you can have it over here, not over here.
Just,
Does that make sense?
just another thing that I became aware of. There's a non-germane amendment that's being offered and will be heard by municipal and charitable gaming in the House this Wednesday. I believe Representative Rochefort is the prime sponsor of that. It's under House Bill 1223, but it essentially removes all the wording in that
It's just,
bill.
right, they're using his vehicle. Yeah.
And it's a little bit unclear to me, but it establishes a local option that applies to horse racing machines and also applies to charitable games, games of chance, and leaves the Keno system in place, so it doesn't change that. But it essentially provides for, enables a vote at the town level to have or not have these games. It's the way I
Again,
understand
the
it.
question is, let's say you pass this. It sounds like that it would not affect those that are in the pipeline, or do you think it would?
I don't know, it's a little unclear. What do you think? I don't know, has anybody seen this?
All right, really what the effective date is. So the effective date is July 1, 2024, which is the same effective date as the 7-year moratorium bill. So,
Right, so this is, okay, we're not gonna solve this.
Yeah, I know,
We're
it's
running
just,
out of time. So now,
just
thanks for that
information.
update.
I have no involvement in this, I just was
No,
told
no,
that.
thank you for that, though,
Yeah.
that's great to know. So we'll come back to that next meeting. I did add one that this is just for us to consider. I want to learn a little bit more about license transfer, how that works when a facility is sold. But,
Transfer, it's the company shares are sold to another company.
all right, so the shares are sold, that's what I'm trying to understand.
Yes.
So the shares are sold,
Yes,
that's the way that, and the license is part of the asset? I guess?
correct.
Right,
Whatever is transferred, whatever is bought as part of the company that is bought, the company that had a license to operate, the company that operates the facility is sold to another entity. It maintains its license. The license isn't transferred. The corporation owns the license and it's part of the corporate assets.
so let's take a real life example of Concord Casino.
I really wish you didn't.
Oh,
yeah, let's not do that.
Scaring this end of the table over here. I've never said it, all these meetings, I've never brought them up. But there's, well, all right.
So Charlie, again, if I understand correctly, the way it works is that again, where a business is the license is an asset of the LLC or the S Corp or the C Corp, whatever form of business it is.
Yeah.
If someone buys that business, that's an asset, just like any other asset of the business. However, because it's a regulated industry, anybody who buys that and has more than, is it 10% or more ownership has to go through the background checks, and financial checks,
Yeah.
and everything else.
Correct.
So
Yeah.
the new owners have to go through all of that.
Correct. Yes, it's a very, as some folks at the table know, it's a very, very lengthy, comprehensive process. Yes.
And I bring it up just for thoroughness. You know, it's something I was thinking about, and I go, you know, we should talk about it. It sounds like, the vibe I'm getting here is that people are comfortable with the statute as it is right now. Is that
Mr.
safe to
Chair,
say?
if I could
Oh,
just-
okay, no, okay, we
just
want the
add,
AG's input on this.
So this is very similar to how environmental permits work. So if Senator Lang owned a solid waste facility and he was going to sell it to Waste Management, for instance, he wouldn't sell the asset, he'd sell his entity, because that way the DES permitting would go with it. So it's not unlike that statutory scheme.
Right.
Or I should say regulatory scheme.
Because, yeah, Representative, then we're
I'm
going to talk
just
about the next meeting. Yes.
Curious, quick question, maybe Charlie can answer. Do these buyers, because we've seen a few get bought out, do they go through the process prior to completing the sale with, or is it something they go after the fact?
If I were, I don't want to get too in the weeds, but it's bought contingent upon their approval.
So again,
But they do expend significant resources prior to. Yeah.
again, I've chaired many of these, and I'm always thinking about the final report, and that's in November, but I'm already thinking about it. And so this one, you know, I want to say that we discussed this and that we're comfortable with it. I mean, there may be this much in the report, but that we touch that base. Now, doesn't mean we don't discuss it again. I think probably when we write it before we approve the report, that'll be in there. But if anybody has any other issues with the way this process works, you know, bring it up. And, but for now, it sounds like we're okay with the current situation. Senator, yeah.
Just the current situation still is a bit unclear to me based on the decision that was made by the individual who heard the case. There's an appellate process that could be exercised by the individual, and they have a period of time which to dispose of the license. Now, I'm not sure that people understand. I didn't understand that when you dispose of the license, you're disposing of the LLC. So you're disposing of the LLC, but within the confines of this sale are all of the amenities that comprise that LLC. Does that mean any debt that the LLC is incurring, or any financial problems that the LLC has, or any legal problems that the LLC has, are all acquired by the individual who's acquiring the LLC?
This is a pending matter, so I'm not at liberty to discuss it in a public forum. So I apologize.
Your apology is accepted.
Yeah.
As always, Joe.
All right, so I'll consider this not fully closed issue until hopefully the other matter is resolved.
It's still an open question to me.
Yeah, okay. Okay, I'll bring this up in a couple of meetings from now. And that, anybody have any other business they want to talk about? Okay, next order of business is to come up with a date for the next meeting, and I'm gonna recommend, you know, we're gonna run out of runway pretty quick. I'm telling you. I've done enough of these, and we still haven't gotten the consultant on board yet, so.
I was just gonna say, the one date I'm not available is the 18th.
I'm looking at the 25th. Monday, the 25th. Everybody? And I'm gonna try to get this room again.
Can I bring an air conditioner?
Yeah, no, we gotta open those windows. It's a, this used to be the Supreme Court room? Yeah, I don't know how they do. Yeah. Yeah, that was as of the last calendar year. So you got calendar year, fiscal year, calendar year. I guess we could add, how easy would it be to do the last 12 months at the end of March, period, like, we have data by month, right? And if we can get those rolled up numbers for that period from, whole year's data from, April 1st of last year to March 31st? Is that possible? Okay, yeah, all right. I'll remind you.
Not about March, but we still be in March.
Yeah, but whenever no, I mean, let's let March close. And then once we have March's data, let's look at that for 12 months going backwards. Okay? Is that okay with you? Okay, all right, thanks. All right, great. Everybody okay with 25th? All right, sounds good. We got a plan. Meeting's adjourned. Thank you all. If our guest is still there, thank you. So, hang on. I just want to stay in touch with you.